Assalamu alaikum. And thank you all, and thank you particularly to Sheikh Hamoud, the Mocha Centre, and for so kindly hosting us, and also to you, Musa, for all. So I don't intend to tell you about the challenges faced in Yemen, because I know that you have much greater understanding about this than I do. But I wanted to discuss today Yemen's current situation, putting it in context with broader patterns across the Gulf MENA region and Europe. And these are regions that we at Forward Thinking work in. So I'm going to discuss today how health crises, particularly in conflict-affected countries, can become catalysts for meaningful change in terms of women being involved in decision-making processes. So every 2 hours in Yemen, a woman dies in childbirth. These deaths reveal something important about decision-making. They show what happens when women's voices are excluded from health decisions that directly affect their lives. Health challenges, as I said, create unique conditions for change. When mothers die from causes that could have been prevented, the consequences of inadequate care become immediate and often tragic. This creates pressure that cuts through traditional divides, traditional barriers, in ways that abstract debates cannot. Health issues also build coalitions across typical divides because rural and urban women face the same risks, and different communities share the same basic needs. In Yemen, as you know, health and water have become linked crises. Between 15 and 20 million Yemenis now lack access to safe water and sanitation, a 52% increase since the conflict began. 1/3 of families spend their entire income on water, with treated water costing as much as $20 per cubic meter. And it is women that often bear this burden directly, walking up to 2 hours twice daily to collect water and sometimes facing harassment and violence whilst doing so. While 1.3 million pregnant and breastfeeding women need treatment for acute malnutrition. Between 2017 and 2019, cholera infected over 1 million people, with limited access to clean water, contributing to unsafe conditions for childbirth and general family health. So across the countries represented in Forward Thinking's Women for a Sustainable Future network, which brings together women parliamentarians across the Gulf MENA region and Europe, evidence shows that health outcomes often reflect how much women's voices influence decision-making. Kuwait's maternal mortality rate is among the lowest globally, while Algeria and Morocco's rates remain several times higher, often reported in the range of 60 to 70 deaths per 100,000. Difference lies not in resources alone, but in how effectively women have been able to drive health sector change. Morocco's remarkable 63% reduction in maternal mortality came after sustained advocacy for women's experiences directly to health sector leaders. Similarly, Finnish women's advocacy shaped evidence-based approaches over decades, creating one of the world's most comprehensive maternal health systems. In Bosnia and Herzegovina, women transcended deep divisions by focusing on shared health needs that affected all communities. So despite the circumstances in Yemen, Yemeni women continue to innovate and lead, creating solutions that desperately need to be recognized by decision makers. Community midwives work without electricity, sometimes using fire for light during nighttime deliveries. Mobile teams reach areas with sometimes no permanent facilities. And women's cooperatives often provide mutual health support while managing scarce water resources. Through an EU-Sweden development programme, 346 community mediators, including 33 women, now lead water conflict resolution across Yemen, proving that women can drive change even during. Yemen's water health crisis offers unique opportunities for regional cooperation by combining three distinct areas of expertise. Gulf states possess advanced renewable-powered desalination technology that could address Yemen's coastal water needs. Meanwhile, European countries bring proven systems for women's participation in water governance, with the Netherlands having decades of experience in Yemen's water sector, and the EU having developed comprehensive frameworks that require women's participation in the planning and implementation of health programs. Meanwhile, the Yemeni women themselves have developed adaptive solutions, from mobile health units to women's water management cooperatives to remote medical connections linking isolated areas to specialists. When these three strengths are combined, the potential for transformative change grows significantly. Women-led water management cooperatives could operate solar-powered desalination units, while regional knowledge networks ensure Yemeni women's experiences inform broader health sector developments through existing regional water networks across Egypt, Jordan, Lebanon, and Morocco, to name a few. Yemen's eventual reconstruction offers a unique opportunity to build better systems rather than simply restoring what existed before. As you all know, the reality of ongoing conflict means that formal processes are largely suspended, but this makes documenting and supporting the innovations emerging from women's leadership even more important. These community-developed solutions are creating the foundation for future health sector frameworks. Yemen's current innovations represent exactly the kind of adaptive, responsive approaches that decision makers need to understand and scale. But these solutions can only be scaled if women have authority to act on them. The foundation must be built now for lasting mechanisms that will allow Yemeni women to influence decision-making once formal governance becomes possible again. Concrete action can be taken to ensure Yemeni women reach decision makers. Gulf states can establish pilot renewable-powered desalination projects working with Yemenis in coastal areas, designed and managed with women's leadership. European countries can support with water health programming that requires women's participation in planning and implementation. And regional networks can create formal channels for Yemeni women's organizations to influence member countries' Yemen approaches. Effectiveness will ultimately be measured not by returning Yemen to pre-crisis conditions, but by ensuring that reconstruction includes Yemeni women in designing their country's future. Success means women's experiences informing health system reconstruction and women's organizations having lasting channels to influence sector development. The innovations, insights, and solutions emerging from Yemeni women's leadership during this crisis must inform not just the humanitarian response, but health sector development that will shape Yemen's future. The response to Yemen's health crisis will determine whether decisions about women are made without including them, or whether lasting mechanisms are built to ensure their perspectives shape the developments that disproportionately affect their lives. This is both a responsibility and an opportunity to show that women are not just morally important, but they are practically essential for effective sector development. Shukran.